Because she's still here, I'm going to go the low back and everybody jump in.
Okay.
So now the same thing. Now on the low back, you have ligament problems, you have weakness in the muscles, you have the joint problems. Sorry, I'm going too fast.
No, en la sección lumbar tienes los mismos problemas. Puede ser músculo, ligamentos o articulaciones.
So here we have flexion, extension. You just, for example, any pain here? Is it?
Un
Yeah.
poco. No, a little.
A little bit. How about this one here? How about this one?
Nada ahí.
Here?
¿Hay dolor ahí? No.
Okay, so a little bit on this.
That's it.
Okay. Now, this is L5S1.
Es L5, S1.
So now I'm going to go. How do you get there? You just hold it down and then you just stretch. See, the good thing is, if you ask her, she is really feeling a big stretch, but I'm not using, look at this. I don't have to do much to pull it up. And so you just push it and release, and then push it and release. Come and have fun.
Lo que ella se siente es un
Just find the position and
estiramiento
stretch
fuerte, pero
and
el
slowly
esfuerzo
go.
es muy poco, ¿no?
So you see, you don't have to use much power. You find yourself, because these are very stiff ligaments, and this is how you really. What you're doing, you're stretching those ligaments, and you can move from different places, and it's quite easy for you.
Son ligamentos muy rígidos, entonces ese estiramiento, este trabajo es estirándolos, ¿no?
So you can go on the top of the spine itself and then stretch the interspinosus ligament, yeah, right on the top, and you can also move sideways for the deep muscles. So instead of doing massage half an hour, do 10 minutes that, you're done.
Sí, en lugar de hacer un masaje por media hora, haces ese trabajo en ambos lados y en el medio y ya.
So this is when you do the spine stretching the ligament, and then you go to ligament. This was more on the spinosus ligament, but then you have the deep ones, which are between the interspinosus ligament. I just have to show it to you, and then we go back. I want you to look the slide. So you have these side ligaments here. You see, these side ligaments, because they are between the spinosus, the transverse process. So the transverse process is you have these ligaments. Now we have to go lateral side.
Ahora vamos a tratar los ligamentos laterales, ¿no?
So what you do now is you activate lateral flexion. So and then you hold the spine down, and then you start stretching again. So now what is happening from this, I'm doing that. Stretching the sides ligament. So this gets smaller, but this one gets bigger on the opposite. So and then you
Está
stretching.
estirando los ligamentos laterales, ¿no? Un lado se abre, otro se cierre, ¿no?
And just try it. This is very gentle. It's very soft. Try. Be brave. Yeah, just squeeze it nicely there, and then you pull and relax, and then pull and push. So you're pulling, but you're pushing at the same time. So it's about the rhythm now. You need to get the equal force between pulling and pushing at the same time.
Es un ritmo de empujar y estirar a la vez, ¿no? En un ritmo.
So in this case, where your hand is, how much stretch you're doing. And sometimes the patient has so much pain, you have to go very gentle. Yeah. So it's how much you're pushing. I mean, again, you can see she's doing much easier job, but very effective job.
Lo
So-
que hace es, para ella es fácil, pero es efectivo para el paciente, ¿no? Con poco esfuerzo, pero el resultado es bueno.
Once you use this treatment table, it becomes much easier. As you can see, my position is important because actually I'm just putting my weight on her. I'm not working, I'm just pushing her. And then this is just easy to I mean, this is so gentle. I don't need much force. It's just my weight on her. So in that case, I'm not actually having a hard time. It's much more easy. And also, I need to remember my posture. You cannot do this. This is going to kill you. So you really need to have a good posture. And like I can do this all day long, and it's okay. So then you can move from different vertebrae, going up and down to L1, back to 2. Here is 3. Number 4. Number 5 is here. And then once you finish, you can now do the combination of the 2. So now what is happening? I have this and I have that. So I can go into rotation. So I can really work nicely in a rotation. At the same time, you see I'm doing traction, but I'm also doing rotation. So this is it. You go in, stretch, and relax. See that? So I really can get a very nice movement here. Well, as long as you feel comfortable and you move to. So I just want to also this guy. As soon as she's out. Yeah, I mean, if you feel like she's more ready to go, yeah. But see, this is, you can really combine traction, rotation. So it's how do you use the table. But again, as you see, I am using my body weight. It's my body weight and little energy to do this.
Él está usando poca energía, nada más el peso de su cuerpo, ¿no?
Okay.
Descansando y con el movimiento de la mesa ya está haciendo el trabajo.